Ambulance service, patient breathing.
We're back on the front line, following Scotland's paramedics.
Suspecting an opiate overdose.
For a gentleman said he's got a bomb. There's a RTC bus versus car.
What do you mean by his arm's gone? I need to get these details, OK?
Every day, they save lives.
There's the boot off, all right?
Just had a fit for quite a few minutes.
Hello?
Oh, my God.
We need to be away from that.
But every day, they face new challenges.
When we go into people's homes, they are at their most vulnerable.
I just don't want to be here.
These things are hard to hear, and we hear them on a daily basis.
Just keep pushing, you're doing really well. We are given the instructions to help save their life. 1, 2, 3, 4.
Working remotely comes with challenges.
So if it's a DV the day,
Met some great patients, get some great stories.
That's okay.
It's a great job.
Slow, deep breaths, OK?
It's opened my eyes to life.
This is Scotland's ambulance service, serving more than 5 million people in every corner of the country. This time, we're with crews in Glasgow, Melrose and Ayr.
Ambulance service, is the patient breathing? He's having a fit. It's my son. He's 2 years old. 2. OK, thank you. Please hurry. Now, we've got that help coming to you. It's the highest priority in the area, so we're coming to you on blue lights, OK?
Oh my God, it's round the corner. It's so far.
In response to the 999 call, paramedic Shelby and technician Sophie are dispatched to the scene.
It must be here. It must be here.
Is it here?
Aye, it must be. Aye, I can see the wee one at the window.
Thank you. Thanks. Bye.
What's been happening?
So, he's not been very well this morning, had a bit of a cough. This is kind of only really started today though, and then just 10 minutes ago, he's just had a fit for quite a few minutes.
Did you time it? Did you manage to time it?
Under 5 minutes, because we phoned that on straight away.
We can record it.
Minutes and it stopped with it, so I reckon.
Hello. So, see this wee seizure that you had, can you describe it in the best way? Like, what was it, legs and arms?
Aye, legs and arms, and it was his eyes. Just both legs and arms. His 3 eyes were going as well.
Yeah, thinking, what's happening? How long is he going to be like this? Is there anything that we can do? He's got a raging temp, 39.1. This kid's really, really unresponsive. We would call it like a floppy baby. So, when you're saying unwell the last few days, what's been happening? Right.
Mainly just a bad cough, bit of a runny nose, feeling really hot to touch, and just kind of feeling generally unwell.
What was his temperature with you when you've been giving him the Calpol?
I don't know.
You just know that's all right, no bother, that's all right.
And he's actually refused the last dose of Calpol there.
When was he due it?
12 o'clock.
Right, OK. We'll just do a couple more wee checks. So, fit and healthy? No concerns, yeah?
Hugely concerned, really, until just
That's fine.
10 minutes ago.
I'm hoping that he's a bit sleepy just because he's had the seizure. It might take him a while to come round, but we'll just monitor him, see how he goes.
We're reassuring the parents, they're putting their trust in us, so, you know, it's just a matter of keeping everything as calm and collected as possible and keep everybody, you know, on the same page.
We're giving him a few minutes, as much as it's quite disturbing that he's lying here and he's very unresponsive. We've given him oxygen. Hello? Just trying to get response, so obviously you usually give adults and that a bit of pain, but the other things is you can touch their eyelashes and stuff like that and see if there's any response, or you can give them a wee pain just to see if there's any movement. And as you can see, the wee one's not really responding that well. I was like, OK, like, if he doesn't come round here, I'm quite confident and I'm hoping that it's just because he's just had a seizure, but inside, you're like, what if he doesn't come round? You're really considering lifting and taking that kid to hospital as quick as we can, because this isn't normal. Just chuck it in there. I've got medicine here, I'll get that drawn up.
You feel how warm he is still?
He's roasting, isn't he? He's just absolutely roasting. So if he has another seizure, we've got medicine we can give him, so that's what I'm drawing up. But
right, OK.
He was having small seizure activity that myself and Sophie noticed while he's lying on the couch. We could see his fingers twitching and his shoulder twitching, which would indicate to us that he was going to have another seizure. This is called midazolam, so it's a muscle relaxant and a sedative. So if the wee one has another seizure, we can give him this, and it would ultimately stop the seizures. I always prefer to be a bit prepared and have it there, and if we don't need to use it, then that's great.
There's been a call into control for a house fire, but there's very little information apart from they believe the calls come from someone who's bedbound.
SORT team leader Daniel and paramedic Diane have been dispatched to a flat fire in the southeast of Glasgow.
They're advising they can smell smoke, so they've actioned the fire brigade and ourselves. Yeah, apologies to disturb again. I take it we don't have any further details regarding the nature of this incident, just to ensure we've got enough SORT resources heading.
No further updates, over.
The majority of jobs we go to are those that, in their nature, they have a more complex structure. We go as a team that's able to create a command structure, liaise with our emergency service colleagues, get a good idea of what's actually happening, and then ensure there's good comms between those divisional resources on scene, ourselves, and control. Yeah, I think this is the terrace, but they're the court.
Upon arrival, it's clear that the response from the emergency services is significant. Police, 2 fire crews, and 5 paramedics are all on scene.
375 on scene. All right, how's it going?
The fire service has extinguished the flames, but they are worried about the occupant of the flat.
Just through there, there's 4 firefighters treating them just now.
OK.
One of them will give you a wee handover.
OK, no worries. I'll go. Thank you.
So we've come in and we found him on the floor.
OK.
He's dropped a cigarette on himself, so his clothing was on fire when we came in.
OK. John, were your clothes actually alight? Or were they just kind of smouldering and they're actually on fire? OK. John, did you wake up straight away? Not sure. OK.
The patient, John, has already had emergency dressings applied to his burns by the fire service. But now Daniel needs to know how severe the burns could be.
So I take it what was left of the clothes was still on, John? As in, OK. Nothing actually adhered to the burn? Was it all something? OK. Severity of the burns, was it just like reddening? Was there blisters?
There's no blisters or anything,
okay.
But it's blackened and
OK,
quite
so
yellow
it's just,
as well.
OK. Sounds like potentially full thickness burns across left side, yeah. So it's black and yellow, no blisters as of yet.
Daniel is supported by local paramedics.
And by the sounds of it, he's awoken, got out of the bed and rolled over to probably extinguish it.
As the medics survey the extent of John's injuries, it becomes clear that he has suffered severe burns.
Our initial thoughts of a burn, we're looking to estimate the size. I feel there is some benefit from having an idea of the initial depth, only because it gives you an idea of the intensity of the fire. that if the person has some degree of full-thickness burns, where the intensity of the heat source has destroyed every layer of the skin, right down to the nerve endings within the skin.
Just relax that arm down, John. Just relax, just relax. Good man.
They've been very close to the heat source, as in John's case, it being from his shirt. It also indicates that it was substantial.
And no pain anywhere.
You've been a tripper, haven't you? You've not complained once.
John, you're in no pain at all. You've got no pain across your stomach. Your burns aren't giving... Is that no pain as in no pain, or it's no bother, I can deal with it?
You need to tell them the truth. Are you in any pain at all?
No, I'm not pain at all. OK, because if you are, we can give you something for that. No pain, no pain. No pain, OK. That's all.
The patient will be pain-free because the whole, all layers of the skin have been destroyed by that heat source. It also leaves them very vulnerable to infection because that barrier between the outside world is effectively completely destroyed.
I think what we're going to do is bring the trolley bed in. So we'll get the trolley bed hopefully right in. We'll help you up and get you onto the trolley bed, OK? Do you just hold on to me? And we'll keep you covered up. And we'll have a wee seat on the bed, John. The bed's behind you. Have a seat. And we'll swing your legs up.
That all right?
As paramedics move John onto their trolley, Daniel sees the extent of the burns for the first time.
What's your percentage thinking, Diane? From his described to me 5 to 10, but I've not seen the back.
It's coming right round. Yeah.
The burns were of a percentage that, were they to increase and the nature of them to worsen as they do over the next hour, 2 hours, were up to a degree life-threatening.
Daniel wants to get John into the ambulance so they can properly assess his injuries.
Any burn over 15% is significant, that person needs to be in a burns unit as quick as possible.
What we're going to do is we're going to put these on for some clean ones, because we don't really want them wrapped around you either. We want them crisscross, which is, they've done a great job, obviously, to get some fluid on.
Are you able to sit forward with me?
Yeah. Do me a massive favour. Could you grab a pair of scissors, and as I cut them, just...
Yeah.
Once we're ready to go.
Let's take this off, just because it's wrapped right the way around. Yeah. Ollie, this is the...
Is that getting sore now, John? It looks like it's reddening up a little bit. Is it starting to get sore? No. Still no pain? No, no pain, no.
With the new dressings in place, Daniel tries to assess how much of John's body has been burned.
I think 10%.
Yeah, I'd say probably back.
So 10, I say 10 to 15% covers us, doesn't it? For a gentleman of John's age, anything above 15 to 25% is really a significant injury.
Daniel calls ahead so that the emergency department is prepared.
We have a 74-year-old gentleman who's been involved in a house fire. He has 10 to 15% burns across his abdomen and back, made up of partial and full thickness burns. ETA to yourselves is approximately 10 to 15 minutes. They're going to see you in resus. So.
I'll leave you in Matt's capable hands, OK?
He's currently got no pain, which is suggestive of us that he's got nerve damage below them burns, so they will definitely need further treatment through a burns unit.
The firefighters who were first on scene are keen to hear how the patient is doing.
Was that full thickness?
Yeah, so the yellow-black bits are full thickness, and then there's all that kind of reddening around it. Debriefing is essential, whether it's within your ambulance service team with clinicians or with the fire service, because they are always curious about the treatments they give. What we've had to do is we've had to take your cling film off, only because if you wrap it and that swells, it can pressurise it. So
we tried to put it on quite loosely.
Yeah, I mean, it was perfect. For them to then chat to us and ask us what we think gives them an idea of, one, why we potentially would remove bandages or change things that they've done. It's to ensure that they don't think we're implying what they've done is wrong. It's just to give them an understanding of what effectively is what they're going to see a lot, which is burns.
Hey, nah, that's good. Thanks for that.
No worries, thank you.
Cheers.
Cheers.
Hello?
In air, Shelby and Sophie are attending to 2-year-old Alistair.
This child was really, really unwell, like extremely unwell. I think we knew that, parents knew that, everyone knows how unwell the child is.
We know he's got the temperature, but you still don't know if there's anything else underlying.
You're all right, my boy. Dad, it's all right. You see your oxygen mask on. You breathe.
We love to hear babies cry.
Yeah, I was gonna say.
We absolutely love it.
All right, you want that off?
I was so relieved once he started crying on the couch. It's really, really stressful. Sitting, waiting to see if he's going to come back round, when he's going to come back round. So I was very happy when he started crying. Like, I love babies crying because they're okay.
I know, it does sound bad, doesn't it? But it's, yeah, like you say, it's always, yeah, it's a good sign.
Right. That's you.
Put these wee dots back on you, I'm sorry. I'll leave you alone in a wee second.
So I'm going to be really annoying and wake him up. The medicine is more important.
Alistair, you can help, pal. Look. Say hello.
No, I'm sorry. Can I give you some medicine?
I've given him Calpol so that we could get his temperature under control, because once you get his temperature under control, hopefully the seizures would stop, and that's what your biggest goal is.
Oh, amazing. All gone. Will we get a wee sleep now? A wee sleep.
Right, let's go. Thanks, Sophie.
Alistair is being taken to A&E. University Hospital Cross House is a 25-minute drive away.
Can I squint your ear, darling? Oh, no, I'm sorry.
We just want to know that the Calpol's working. In the back of my mind, I'm thinking, if this doesn't work, he's going to have a really high risk of having another seizure that we're going to have to manage in the back of the ambulance driving to hospital.
It's a worrying time for both Dad and medics. But on the way, Alistair gives them all a clue as to what could be causing his high temperature.
There. You sound as if you've got a wee bit of crypt. It's not crypt season as well.
So crypt's a type of infection, mostly common in winter, but you can get it any time. So it inflames the throat and the airway, and then it becomes infected. So, and that's when you can end up getting temperatures, coughs, colds. It usually comes within a kind of 2 days of having a runny nose and a kind of cold symptom. The only way that you would really know with croup is a seal back, so when they cough it sounds like a seal, and that's the only way to know. But if you get it quite early, it's not life-threatening, but it can be a life-threatening condition, because if the throat keeps swelling up, it flows over. Now I know why he's got the temperature, why the infection's there, so he has croup. So as a paramedic, we can give dexamethasones, which is a steroid. Put the tablet in there, and then we draw up the water. So you need to dilute it in water or Calpol, but if you put it in first, and then you're going to start shaking it and diluting it. So that's a good tip for you and all.
But giving medication to a sleepy toddler is easier said than done.
Can we sit you up a wee bit? Oh, there's a big boy. Hello.
Special boy.
Ali, can you take some medicine for me?
Can you? No. Right. I'll just leave it then. He had been through the wars, so I really struggled to give him the steroids. Let's go.
Shelby decides to leave giving the steroids to the nurses at Crosshouse Hospital. In the heart of the borders, Mark and Lee are starting their shift.
How are you this morning? You all right?
I'm good. Did you sleep well, Lee?
Oh, not bad, mate, not bad.
You been looking forward to the days off, though?
Off for the weekend, mate. In fact, I'm not back now until next weekend. I'm off till next Friday. What about you?
Off to see AC/DC on Wednesday, down at Wembley, so can't wait. It'll be good.
Yeah. How are you getting down to Wembley?
Train, so we're going to go down from Berwick.
That's interesting. I thought you would probably take the highway to hell.
Mark and Lee have been dispatched to the town of Selkirk, where an 80-year-old woman is complaining of chest pain.
Well, female has 3 stents fitted after heart attacks. Well, I don't know when they were.
And it was our daughter that actually raised the alarm and called 999. Is there anything else that could be causing that pain? Is it a respiratory pain? Is it potentially cardiac pain? There's lots and lots of factors that we need to consider. We're en route to this job.
So I think I'll just park here until we go and assess and see where we're at. And that gives them plenty of room to get out as well.
Good morning, Helen. I'm Lee. This is Mark.
Hi. Nice to meet you.
So this feeling you had this morning, was it in your chest coming in across?
It's right up to here and going up my neck.
Up in your neck, OK.
Right.
And I went and took a couple of my puffers this morning.
OK.
And it's gone, but you can still feel it's there.
Which puffer did you take this morning? Was it your red one?
It's the GTN one.
The GTN spray.
So GTN is what's called a vasodilator. So that actually opens up your arteries to allow the blood flow.
Have you had this feeling before?
Oh, yeah. I've had 3 heart attacks.
Had 3 heart attacks. OK, when were they, Helen?
First one was 2010, and then it's been years in between.
OK. She had an extensive cardiac history. She had 3 previous heart attacks. She'd had 2 previous strokes. She had quite a significant medical history.
Just going to pop that on a finger. Someone who with chest pain, immediately you're going to look at ECGs to understand if there is any cardiac problem that we can identify at the time.
Give you a full MOT.
All part of the service.
So this morning, since this episode this morning, would you say you were completely pain-free now?
No, it's still the aches.
Still in your shoulder?
It's a dull ache now. So that spray must have helped.
I'm just going to check your blood sugar, OK? Normally we get Mark to do this because normally his charm tends to help with these kinds of things.
Oh, right.
So he's got your pulse going as well, for all the wrong reasons.
A wee scratch in your finger, OK?
Yeah.
Well done.
Oh, you've got some. That's amazing.
Oh, he's an expert.
So your BM's 15.9, OK? You had your breakfast this morning?
No, but I was bad last night. I had chocolate.
You had chocolate last night?
That's OK, though. You're all about chocolate.
Get that wee
I
squeeze.
couldn't resist it.
I mean, there are some very stoic patients out there who have been through so much in their lives and they've learned to deal with various multiple health conditions over the years, and they just crack on with life, don't they?
Helen, you've been through a lot.
And I was just getting on my feet. And I'm going on holiday September, come hell and high weather. I'm going on holiday. We're going up to Piper Dam.
Oh, nice.
It's absolutely beautiful.
OK, you can breathe again now, Helen. OK, we'll just print it off and we'll have a wee look. So there's nothing jumping out in your ECG. OK. Because you've had this episode today and because you've still got this pain, I'd be quite keen to take you up to the hospital for a blood test. If there is something happening with your heart that's causing this pain, your heart lets a protein into your blood called troponin.
Yeah.
I'd like you to go for a troponin test, OK?
Yeah.
But nice and calm, nice and relaxed.
Yeah, no, I'm fine. I'm fine.
What would happen is they would take a blood test within A&E to identify if there's any troponin in the bloodstream. If there is, if that troponin level is high, that could be an indication of that person's had a heart attack.
You OK, Helen? Just take your time, OK? You managed that lip.
Helen will be taking the short journey to the Borders General Hospital for more tests.
You ready, Helen?
Yes, I'm ready.
First floor.
Hopefully, with some good news, she'll still be able to go on her holiday.
Right, everybody happy?
Thanks, Mark.
I'll see you at the other end, Helen.
Okay, fine, thank you.
So Mark is your pilot this evening, okay? Unfortunately, we broke the drinks trolley at the start of the shift today, okay? But what we'll try and do when we get to hospital is try and get you a cup of tea, okay? Well,
how we doing, Lee? You okay?
Good to go, Mark.
"999 calls for the ambulance service come through one of 3 control centres across Scotland.
Let's just confirm it. Is he breathing just now?
Call handler Lauren is speaking to an extremely distressed caller.
You're doing really well. Just try and stay as calm as possible. I know it's a really scary situation, but just try and stay as calm as you can.
The woman on the phone says her partner has suffered an overdose.
Okay, do you know what it is that he's taken? William. Just to confirm, he's unconscious at the moment, is that correct?
Receiving calls, for example, like a drug overdose, it can be heartbreaking listening to the pain in their voice, talking about their loved one going through that.
Okay, so I need you to look very, very closely and tell me, can you see him breathing? Okay, so he's not breathing at the moment, is that correct?
She didn't know if he was breathing, he wasn't awake, he was changing colour, so it was just a lot happening in quite a short time. So I could hear how panicked she was in her voice.
Okay, is there any Narcan or naloxone available? So I want you to give it to him just now. That's no worries. So I know that you may be angry with you after it, but what we need to do is we need to help him just now.
Narcan or naloxone, which can also be known as peroxide, is usually a needle or a nasal spray that you give to someone to reverse the effects of an opioid overdose. Sometimes we will get a sort of negative reaction. It usually takes away what they see as their high, and they can get quite upset, they can get quite angry.
Do you know what type of device it is that you've got? So if it's the injection or if it's the nasal spray? It's the jig. So listen carefully and I'll tell you exactly how to do this. So remove the clear film wrapping.
She was trying to administer naloxone and she was very upset.
No problem. Just remove the clear film wrapping by pulling the tear strip on the side of the box.
She'd mentioned to me at the start of the call that her previous partner had passed away from similar things.
I know it's a really scary situation, but you're doing absolutely amazing. So what we need to do is we just need to help him. So just let me know when the plastic top's off from the syringe.
We don't judge the patients. We don't know anything about their life, and we have a slight 5 to 10 minute window.
Okay, no problem. And with the needle still in its sheath, screw the blue fitting onto the syringe. And so do that just now and tell me when it's done. Is that the ambulance crew with you? No problem. I'll leave you with the ambulance crew. You've done really, really well.
The caller passes the needle over to the ambulance crew for them to administer.
Carrying naloxone around can be the difference between someone's life and death. So I started personally carrying Narcan and naloxone when we had people come in to the ambulance service to teach us all about the effects of it. So it gave me a lot more insight and it made me feel as though I could be a big help in someone's life if I ever came across that situation.
Around 30,000 naloxone kits are issued in Scotland each year.
And here a lot of us have it. I personally carry it in my car at all times, just in case. It's quite a good thing to have.
After those calls come in, it can take effect on you because you hope that they get the help that they're needing afterwards. You hope that they go forward into a happy, healthy life. But again, you never know what's going to happen after a call. And I just need to hope for the best and hope that that person, no matter what they do, that they're safe and that they're happy and that they're healthy and that everything that I could have done in that time, I've done.
Ambulance service, patient breathing.
Driver there, it's an ambulance job, is it? Ambulance service, is the patient breathing? Yes, he is. Yes, he is.
Tell me about what's happened.
I found a farm worker who's just had an operation on his knee and he thinks it's popped out or something. Yep.
Down in the borders, it should be time for lunch. But for paramedic Lee and technician Mark, food will have to wait.
So we're off to a 32-year-old male on a farm who's dislocated his knee. He's describing that the gentleman's already had some surgery recently on his knee and he's felt a pop on his knee while he's been working. So we'll go and find out what's going on with that.
The team here have to cover a patch of more than 1,800 square miles, and the journey to each call-out is often a long one.
Sometimes you're driving in blue lights and you would like to stop and admire the view, but...
Are you enjoying your view, Mark, are you?
I love it. You just keep your eyes on the road. I'll describe the beautiful countryside as we pass through it. But you would take this over city work any day, wouldn't you? I love it down here. I love the scenery. As an area to live in, it's stunning. I wouldn't want to live anywhere else.
The emergency they're going to today is on a farm, and Mark fears the dislocated knee may have complications that will make it a far more serious call-out.
It's all to do with the muscles around the kneecap, essentially. A deviation from a normal standing position can push your kneecap out of position. Is there any compromised circulation to his lower leg in any shape or form? Is there any what we call critical skin, where there's been a break or a fracture and you can feel the ridge where maybe a bone or something's pushing up towards and trying to come through the skin? Lots of things to be aware of. This must be up there because we're doubling back up on ourselves.
Hi, mate.
He is all right. He's just in pain, but he's in the shed at the end there. Yeah.
Just the first one here, yeah?
Thanks very much.
Thank you very much. Thank you.
Thanks,
Right,
bud.
well,
Good
good.
man. Cheers.
Right in there.
Get right back.
Hi, folks. My name's Mark, and this is Lee that's behind me. Right, Josh, can you tell me what's happened then?
So I was kicked by a cow.
Yeah.
And I had... my leg was overextended and my tibia was compressed, they said.
So we've had some surgery on that knee?
Yeah.
Okay.
And they pinned and plated it.
Uh-huh.
And...
Sorry, I'm just taking a pulse as you speak. Keep speaking.
So I was trying to fix that machine and I felt something go pop in my leg and I went down.
While I'm doing some checks on you, Lee's going to do some observations on you, OK?
Yep.
Right now, though, in the pain in your knee, if 0 being no pain and 10 being the worst pain you've ever had, how would you describe that pain?
Just sitting here at 3.
OK.
If I try and move it,
It goes through the roof?
Yeah.
OK. Did you say it was your right knee or your left knee?
Left knee.
Your left knee.
Currently in its frame.
Ah, OK.
While Lee makes his observations on Josh, he notices something he wasn't expecting.
Are you Toby's brother?
Yes, I am.
Yeah, you look a bit like Toby.
Oh, thanks.
Yeah. I was Toby's mentor.
Lee.
Yeah.
Yeah, my little brother.
So Josh's brother is a newly qualified paramedic that works out at City Station up in Edinburgh.
Since his operation, Josh has been wearing a knee brace, which is now getting in the way of the medics.
I think the best thing, Josh, for me to do is probably just cut these straps. It's going to minimise your discomfort and your pain. Are you OK
Can you
with
not
that?
cut my boots off?
I'll try not to. I can't promise anything, but it's quite important that I have a look and assess your foot as well. I'm just concerned about any compromised circulation down here, so...
Moving Josh could be agonising for him, so Lee has to look at how he can manage his pain.
So Penthrox is a very effective painkiller. It's called the green whistle. It's come from Australia. It's very actively used in places like Bondi Beach and things. So it's got a little propeller in it, and all you do is you breathe with it in your mouth, and it all comes through with this activated charcoal here. OK. Just breathe through the whistle in your mouth. So nice big deep breath for me. So nice and slow, nice and deep.
How's it making you feel, Josh?
A wee bit lightheaded.
Yeah.
The reason we want to get this on board is because your pain, like you said, will increase quite a lot when we start moving, OK? And pain is easier to prevent than to cure. So we want to fill you up with some pain relief so we could start trying to think about moving you, OK?
That's it, good stuff. So, Josh, I'm just going to kind of give you a bit of an examination just now anyway. And I want you to describe if you get any pain in here. No pain here at all. No pain here. But you can feel my fingers touching you.
I can feel them.
You can feel sensation.
Yeah.
Done a good job of tying your shoelaces, that's for sure.
It's just they're a very expensive pair of boots. I don't want them cold.
Okay.
Deep breath, Josh. Deep breath, mate.
Some good hard puffs in there. I'm happy to support.
Okay.
Okay, and then you see what you can do.
Okay. Ready, Josh? Take some of these laces off. I'm just going to loosen the laces a bit, mate, okay?
Okay, Josh.
Good man.
But we do need to have a look.
Yeah. You need to do a bit of pee at this check.
Absolutely.
Okay. Right, Josh, you ready? Good man.
We're almost there. Just go. Yeah, just go. Awesome. Yep.
With a bit of help from the Penthrocks,
How we doing, Josh?
Ouch.
Ouch. Ouch. You're right to swear.
Lee and Mark managed to safely remove Josh's expensive boots.
You just snip it. Snip, stop. Okay. Right, Josh, how does that feel at the moment that we stop playing with it?
Better.
Good. Okay. Can you feel me touching?
Yeah.
Okay, try not to tickle your feet. Okay. Can you wiggle your toes for me? Right there. I've got it first time.
Just going to mark where your pulse is on your foot, Josh, okay?
In any injury such as this, there's always a risk of a compromised blood flow. So it's really important that I can assess and understand that the patient can feel the sensation in his foot, that there's a good pulse, which means there's a good blood flow. Yeah. You've got it, yeah. It's quite a good pulse, so that's great. So that's what we're looking for, is to make sure there's no circulation compromised, good colour, all good. So it feels like you've got an isolated injury to that knee.
With the observations complete, the medics will have to confront the challenge of getting Josh from the barn to the ambulance.
There's a RTC a bus versus car. I believe there's 2 occupants of the car. Not 100% sure on their injuries, but there is a critical care paramedic who I believe is on scene, so we hopefully should get an update en route.
The crash is in Paisley, around 10 miles west of Glasgow. With multiple casualties expected, the specialist skills of the SORT team are needed on scene.
We've got the bus, which obviously is quite heavy, into a car. There's also the chance that you're going to get minor to moderate injuries on the bus. So that can sometimes become a bit overwhelming for 1 or 2 crews. With 2 patients already there, they're going to be stretched, so the sooner we can get there, help them, the better, I think.
Local paramedics are already on scene, relaying information back to the SORT team.
SORT team need to control your receiver. Yeah, Roger, just see if there was any update from any resources on scene for the bus versus car RTC, over.
One is a 5-year-old girl with amputate. We have a female passenger with a greedy fracture right arm. Driver has zero chest pain.
Anyone with kids automatically gets that parent response, that the adrenaline comes and you feel more, I suppose, emotionally invested in it, but also that children can't be considered as just small adults. Their anatomy, their physiology is completely different.
Do you want any kit or anything? Or
Yeah, we'll take a defib up. Sort 375 on scene.
With damage clearly showing on the front of the bus involved, Daniel goes in search of the car that's been hit.
What do you need, John?
Jim here, the driver, just pulled out, not seen the bus,
Okay.
head on rock. The passenger and the approach to Jim, looks like she's got a fractured forearm.
Yeah, that's
self-extricated as well. And
Okay.
the 5-year-old girl was sitting in the back with her airbag on. She's
So all from the one car. Bus is fine.
Bus is fine.
Everyone travelling inside the crashed car has escaped with minor injuries.
What's the little one's name? So that's our 4, two little ones in the back of the red car and yourselves in the front. Okay. Okay, so 5 total in the car. Okay.
Daniel's colleague Diane tracks down the driver of the bus, who has been complaining of chest pain.
What's your name?
George.
George, I'm Diane. Just grab a seat there, I'll just get the equipment.
Diabetes, no.
There we go. What time did you start at today?
Started work at 6:30. I've been up since 4:30.
Oof. So your blood pressure at the minute is sitting at 161/106, so it is a wee bit elevated, but that's understandable.
Right.
So no other pain, no pain in your knees or your ankles or your...
My leg, the hip this side, and I'm starting to get pain there.
Okay.
Just the below the ribs.
So you think it was off the steering wheel?
The steering wheel is a different thing, yeah.
Okay. So your heart's looking good.
Thank God for that.
Not concerned about that. Pulse is nice and steady as well, and your blood pressure's starting to come down, so all going in the right direction. Yeah.
With the patients now all assessed, Daniel is happy that there are no major injuries.
Are you happy that if I move some of the debris from the car, just so we can go that way rather than come over your investigation?
No, it's fine. You won't come much, but
And we'll start getting everyone out of the way and clear the scene for you. Yeah, Roger, thank you. Just details for the Paisley RTC. That's 4970 heading off to Royal Kids with 2 patients, no obvious injuries. Unfortunately, any RTC is a matter of luck around the circumstances that you find it in. That dispersal of energy and force, it doesn't take a lot for that to be changed, for it to be a much more serious incident. Second vehicle will shortly be departing for the QE with one 64-year-old female with a right fractured arm. We are still waiting on one conveying divisional resource for a 6th patient. I have their details and obs if you'd like.
With transfers for all the patients arranged, Daniel and Diane will stand down.
I think we're just about there.
What we're thinking at the moment is if I get you boxed up, make sure you're on top of your pain relief, and what we'll do is hopefully assist you to standing on your good leg and get in a position where we can almost just take a small shuffle, a small step onto the bed.
Paramedic Lee and technician Mark are treating farm worker Josh, who they suspect has dislocated a knee that he recently had surgery on.
Deep breath, Josh, nice and deep.
Okay.
Good man, okay. On your shirt.
Okay. Okay, ready, steady, slide. That's it, good, Josh. You're helping me, which is fantastic and really helpful. You're doing great, Josh.
Excellent, Josh.
And that is in a brilliant position. Good. Okay, we'll give you a minute.
Deep breath.
How's that? So.
I'll give you a minute, I'll bring the trolley over.
I think so.
My surgeon's not going to be too pleased.
No, but unfortunately these things happen with these types of circumstances. It's not unusual for somebody to have your type of surgery, and because your muscles, the tendons, the bones, they're all quite weak and take a bit of time. Okay, so the plan at the moment is using your good leg, take all the pressure on that, and we'll try and assist the trolley as close as we can. We'll get you straight onto the trolley bed. Okay, on 3. 1, 2, 3. Good stuff, Josh.
Josh,
right up. Right up on that leg. Take the pressure off. You okay?
Yeah.
I'm going to have to move, okay? Josh, I want you to aim for there. Just try and hop back 2 degrees the best you can. That's it. Hold on to that. That's perfect. Well done, fella. You need to come back a bit. And you're there. You're down.
I'm down. Good man.
And take a minute.
Take some breaths.
Take a minute. We're going to go for this. Straighten that leg out. I'm going to guide that leg. Lee's going to guide that leg. There's somebody behind you, and we're just going to kind of gently swirl you around, OK? Straighten that out, fella. OK? OK. On 3. 1, 2, 3. Nice and steady. Nice and steady. Nice and steady. Nice and steady. Brilliant.
Good effort. To you.
To me.
To you.
To me.
To you. You'll be too young to remember the Chuckle Brothers.
Eh? First floor.
Entertainment section.
Anticipating the bumpy and painful journey ahead, Josh receives 2.5 milligrams of morphine.
Right, we'll see you at the other end.
Cheers.
How How are you, Lee? Ready to go?
I'm good to go when you are, mate.
How are you, Josh? You good to go?
Nah,
good stuff. That's the main thing.
With the farm track behind them, it's open road for the 20-mile journey to Borders General Hospital. X-rays will reveal the extent of the new damage to Josh's knee.
Hello.
Hello. Only then will he have an idea of how long his recovery will take. Back at the ambulance control center, Lauren is beginning her 10-hour shift.
I've been working here nearly 2 years, patient transport services first, and then move over to accident emergency because I thought it sounded a lot more exciting. But it was a really fun change for me. It was quite good. I was the youngest in the service at one point. I love doing what I do, and I love helping people.
Ambulance service, patient breathing.
Lauren is taking a call from a concerned granddaughter.
Sorry to interrupt you, I just need to ask a few wee questions just before I take any details. It's just confirm, is the patient breathing? And is the patient awake? OK, tell me exactly what's happened.
The caller is worried that her grandmother has had a stroke.
I would say, personally, I think stroke or stroke symptoms is one of my most common jobs that I could take.
And you said that she's not responding normally at the moment, is that correct? Yeah, that's no worries, you've done the right thing by calling us. OK, and exactly what time did these symptoms start? So about 20 to 1, is that correct?
When we get someone phoning in for having a stroke or having stroke symptoms, we do what's called a fast test.
I know that you are saying that she's not too keen on doctors. Would you be able to get closer just so we can do a quick test on her, just for the medics to make sure that we're getting the correct information? Just get close enough to ask her to do 3 things and just let me know when you're ready.
Usually we'll do that to find out if there's any facial drooping, facial paralysis. One of the key ones that we'll do it for is there's patient speech, which usually is quite a good indicator as to what's going on with the patient at that time.
So ask her to smile. Perfect. And let the smile equal on both sides of her mouth. And ask her to raise both arms straight out in front of herself and hold for a moment. Perfect. When she's able to raise and hold both arms equally, ask her to say, "The early bird catches the worm." If you're able to ask her, if she's not wanting to do it, that's all right.
It's not the end of the world if they don't want to answer the questions. It's just to try and get us a better understanding as to what sort of symptoms that the patients have.
I'm organising help for you just now. Stay on the line and I'll tell you exactly what to do next. So from now on, we would just advise you just to let her rest in the most comfortable position, wait for help to arrive. Just try and reassure her just that help has been arranged for her. If anything does change or worsen at all in the meantime, just give us a wee call back. No problem at all. Take care. Bye-bye. The phone is a precaution just to make sure, and we've taken it down stroke just for the worst case. She phoned quite quickly, so hopefully they managed to get her the correct help. Just want to help everyone. Well, if I had my way, I'd send everyone an ambulance.
So we've got a male falling downstairs, used his GTN spray
999 mode activate.
Twice throughout the night. He's got pain in his legs and his chest. So, yeah, I wonder how many stairs he's fallen down.
Paramedic Shelby and technician Sophie have been called to a 73-year-old patient who has fallen outside his home and been found by his sheltered housing warden.
So we're probably thinking he's probably had chest pain throughout the night. Maybe a wee drop in blood pressure, yeah. Doesn't say he's still on the floor. No.
The call-out is even more urgent as the patient has heart problems and is currently complaining of chest pains.
Oh, there is there.
Oh, he's there. Oh.
Oh.
Hi there. Hello.
This is Eddie.
Hi, Eddie. So I'm Sophie, and this is Shelby that's just coming behind me. So what is it that's happened? Have you fallen down these wee stairs? Yeah. When you fell, did you lose consciousness or anything when you came down these stairs? No. What do you feel happened? Did you just trip?
Just need balance.
Your balance. You didn't feel dizzy or anything before you went down?
Slightly, but...
Slightly.
I'm just going to check your blood pressure and that while Sophie's chatting away to you.
That's okay.
There we go. We've had a wee message that you'd taken your GTN spray, is that right?
Twice.
Twice. It's a vasodilator, so it allows all the veins and arteries and things to open up, and it allows the blood to start flowing better. It's a drug we give very, very commonly to people with chest pain that we're suspecting, you know, is of a kind of cardiac origin, along with aspirin we normally give it. And when you took your GTN spray, did you get any relief from it?
A wee bit.
Have you got any pain in your neck at all?
No, it's just my hip. It's
Your hip, and it's all down that right side. Are you able to move that leg at all? A wee bit. Can you wiggle your toes? No problem. Right, I'm just going to have a wee feel down here, all right? That sore where I'm pressing? Yeah, right in there. Is it sore higher up?
No.
No. How is your back feeling?
Well, I've always had it sore.
You've always had a sore back, so you've not got any new pain today from your back? So I'm just going to come over this other side. Are you able to straighten this leg out at all?
Sore?
Is that as much as you can straighten it? That's what we look for with this kind of pain, is if there's any shortening or rotation in this leg. It's obviously difficult to assess because we can't get the leg completely straight. Are you able to straighten this leg out?
Don't have it in the knee.
The knee, so this knee's sore? Yeah. Just give it a wee press. That sore in there?
Right, 1, 2, 3.
Big push. That'll feel a wee bit better than the floor.
Take a wee minute.
Yeah, just take your time. We'll get you into the ambulance and we'll just carry out a wee assessment in there, all right? So has your chest pain fully resolved now, or have you still got a wee bit of chest pain?
Oh, right.
Yeah. Just because you're saying you had a wee bit of chest pain earlier, is it all right if we just get a wee tracing of your heart? Is that all right? You'll have had that done before, have you?
Aye.
Yeah, plenty of times.
The last thing I done was my heart rhythm wasn't right.
People with angina can have chest pain and it can radiate into their jaw and it can go down their arm. And that's, as long as that's normal for them, they're advised to take their wee GTN red spray.
So just nice and still, we're just going to take this wee tracing, all right? It'll take about 10 seconds. We're looking for any changes, so we're looking for any elevation, any depression, anything alarming. We're looking for a low heart rate, a high heart rate. There we go, that's you can move now.
With worries about Eddie's heart put to one side, the team now look at his mobility.
Our concern is it's obviously quite painful just now. Are you able to manage about?
Well, just do what you've got to do.
Well, if you were to go back in the house, I don't think you'd be able to walk from here into the house. Would you agree?
Right, I'm used to carpet hugging.
And you might fall and do something worse next time.
I'll just go with yous.
Don't know if it's more a pride thing, don't want to admit that they're struggling. You know, with this gentleman, he was adamant he wanted to go back into his flat.
I don't think you complain about very much, do you, Eddie?
No.
No.
Just get on with things.
I thought so.
With Eddie agreeing to go for an X-ray, Sophie and Shelby will take him to Ayr Hospital, 10 minutes away.
So Eddie, that's us at the hospital. All right.
That's you all booked in, so we'll get you a nice comfy chair.
I love the old ones.
Most of them. Yeah, most of them.
I do like the old ones.
You feel like they maybe appreciate us slightly more sometimes.
You do get the odd cravat one, but majority of the time, I like the old ones.
Manage, me bend in the middle, that's you. Right.
I'm not a good patient.
You're not.
You've been a good
Yeah,
patient with us.
you don't complain much.
I complain, you keep us in.
There we go.
You always come back to, this is why we do that.
Yeah, yeah.
Eddie will be checked over by medical staff at the hospital and hopefully will soon return home to an independent life.
He's on his way. It seemed to just come out of nowhere. I think that was the scariest bit about it, the fact he was a wee bit under the weather, but he didn't seem to drastically unwell, just a kind of normal viral cough, cold type thing, so...
It only happened that morning, we came unwell that morning, then it was the afternoon the seizure happened.
Yeah.
That was his first time he'd ever had a seizure. Really, really scary.
What's that people?
There's another person there, look, another wee boy.
And where has the boy?
So it was croup, just a kind of dry barky cough. Once we got up to A&E, that was what he was diagnosed with. Ah! Eating him.
Don't do that, crocodile.
Crocodile in the water. He did have a temperature as well, which caused the seizure. When he woke up, we gave him a steroid, that was his treatment. And basically, we were at home within, what, 3 or 4 hours maybe?
Yeah, not long. He was fine after a few days of rest and watching Moana on telly. That's his favourite. So, yeah, back to normal.
What's that?
What kind's that?
That?
Giraffe.